Dr. Pakman, let's talk about sealants for children, and specifically, are the sealants good or needed for the baby teeth, the second set, and for that much, are they sometimes used for adults?
Yes, a good question. Sealants have been around for probably close to 50 years. We find that the best indication for any kind of sealant, whether it's on a deciduous or baby tooth or an adult tooth, is if the tooth itself is deeply grooved and fissured. And everyone knows those deep grooves that are on the inner center of our teeth. The deeper they are, the more prone they are to dental cavities. So we advise people to do sealants on the children, at least on their adult first-year molars. And if the baby teeth are very heavily grooved, it can also be done on those. But generally, we're doing it on the first and second molars of the child's adult dentition. It's also a very simple procedure. The materials are terrific. It's painless, and it is tremendously preventative.
So basically, it prevents cavities.
Absolutely.
Right, and the reason it's put on the molars in the back is because they have those grooves where the sugar, the dirt can basically hide itself and
very susceptible.
Yeah.
Very susceptible to caries, yeah. So that's why we seal those.
And how long do they hold? Do they have to be replaced every year, what's the deal?
It's tough. It's tough to say. It all has to do with the child's chewing habits and eating habits, things like that. But they can last anywhere from 2 to 5 years. And then a determination has to be made whether it should be reapplied or not.
Okay, I see. During regular visits, can they be, so to say, fixed and patched up before they, break? So they,
yes. Yeah, we're always looking at them and seeing how they're holding up. Generally, what they do is they just wear away over time with the forces of chewing, and so they do have to be replaced.
Okay. Thanks a lot, Dr. Pakman.
You're welcome.